Emergency room, this is Chelsea. Okay, yeah, patch them through. Hi there, my name is Chelsea. I am a nurse here in the emergency room tonight. Can we start with your name and date of birth? Okay, I pulled you up here. Just in case we get disconnected, can you verify for me a callback number? Okay, I have that in my system. We are good. So, okay. Can you tell me what's going on? Okay, you have a migraine, but you're worried about it being something more serious. Okay. To start, can you rate your pain level for me on a scale of 1 to 10? 1 being like, maybe like a paper cut, 10 being excruciating, like you're gonna pass out. Okay. And did the migraine start gradually or did it come on very suddenly? Okay. And to start, what was the pain level then? Was it as intense? Okay. Okay. Have you taken any medication? Okay. And just looking to see your chart here. Okay, so it's showing that you don't have any medication allergies, is that correct? Okay, just needed to check. So, okay, have you had any nausea or vomiting? How about sensitivity to light or sound? How about any dizziness, confusion? Any visual disturbances like an aura? Okay. How long did that last? All right. So, okay. I want to do something, or have you do something rather, to help me assess the severity as well as maybe give you some peace of mind, okay? Can I have you walk to a bathroom? Yeah. Okay, you're there. How did it feel to walk? Did you lose your balance at all? Okay. So then I want you to look at yourself in the mirror and I want you to smile. Okay. Are both sides of your face equal? Good. Now frown for me. Equal again? Okay. And if you press on your face, on your cheeks, forehead, other side, you're able to feel that? Okay. You can go back to your bedroom, yeah. Okay. So another thing I'd like to do, or I'd like to have you do if you don't mind, is to take your pulse for me. We can do a radial pulse. What you're going to do is use the pads of your index and middle finger, and I want you to feel right underneath the wrist bone that juts out right under your thumb. If you press a little bit towards the edge of your wrist, you should feel kind of a groove between the tendon. Yeah, that's it. Okay, so I want you to press into that groove, and I want you to count the beats for me for 30 seconds. Okay, so then we just need to multiply that by 2, which means your pulse right now is 84, which is pretty good. Okay. So, right now you sound coherent to me. You sound stable. However, I want us to come up with a plan of action, okay? So, what I'd like you to do, looking at your chart, because I don't see any medication allergies, is to take, do you have any anti-inflammatories? Ibuprofen, okay. How about any anti-nausea medicine? Any antihistamines? Okay, so I'd like you to take 2 ibuprofen with 2 Benadryl at the same time, alright? If you're able to stomach it with some food, that would be ideal. If you can't, maybe take it with some juice. It's going to make you drowsy. Are you there by yourself, or do you have anyone that can drive you? Okay. So if after 30 minutes you're not feeling any different, or if you start feeling any kind of new symptoms or any new pain, or the pain starts getting worse, then I'd like you to have your friend drive you to the emergency room so that we can assess you here and make sure that you're okay, and possibly give you different medication or stronger medication. Okay? Okay. So I want you to look at your phone and look at the time, okay? And maybe even set a timer for 30 minutes from now so that you can reassess. Okay. Do you have any questions for me? Okay. Well, hopefully you're able to get some rest. I recommend staying in a dark room and trying to keep things quiet. Do you have noise isolating headphones? Okay. Use those if needed, okay? And just try to avoid any kind of bright light or screens or anything. I even recommend doing that through tomorrow as well, because sometimes people can have a bit of a hangover effect from a migraine. Okay. So yeah, start that timer, okay? And hopefully I won't see you tonight, but if I do, then we'll take care of you, okay? Okay. Chelsea. I'm a nurse here. How can I help you? Okay. I'm gonna get you some paperwork in just a moment. Do you feel like you're able to fill it out? Okay. And are you a current patient here? Okay, let me pull you up here. Sorry, my program is a little bit laggy. Okay. Can you spell your last name for me? Okay, and your first name? Okay, and can you verify for me your name and date of birth? Perfect. And are you still living on 87th Avenue Southeast? Okay. I have a phone number here ending in 8343. Is that current? Okay. So you've been spending time with a friend that you know has been traveling overseas and who suddenly got sick, and now you're feeling dizzy and you're having some chest pain. Any shortness of breath? Okay. So let's do a quick exam with you, okay? So first things first. Do you know today's date? Okay. And you know where you are? Alright. And let's get a temperature from you. Okay. This just goes right under your tongue. Great, okay. Okay, I'm gonna take it back. So your temperature is elevated at 101.2. I have you gaze directly ahead. Just stare at me right between my eyebrows, okay? Good. Okay. Forgive my shaky hand, it's kind of an awkward position. So now without turning your head, I'd like you to follow my light using just your eyes. How did that feel? Any eye strain, any increased lightheadedness or dizziness? So then this is standard for all of our patients. I'm going to need to collect a specimen just to rule out any particular viruses or bacterial infection. So this is just going to go right around inside of each nostril, okay? Excuse me for just a moment. I just need to grab a tongue depressor. Sorry about that. We usually have some up here, but evidently they didn't get restocked. What can you do? Alright, so I can just have you open for me. I just want to check your airway. Good. Okay. I'm gonna remove my tongue depressor. Can I just have you lift up your tongue? Okay, so if you were going to rate the level of pain that you're feeling on a scale of 1 to 10, 1 being like a paper cut, 10 being like you're going to pass out, it's so excruciating, how would you rate it? Okay, and is it staying in the same place on your chest? Is it radiating into your arms or up or down? Have you tried taking any medication to alleviate the pain? What strength? Okay. And how long ago was that? Okay. And do you feel like it's made any difference? Okay. Any nausea or vomiting? How about, have you had any confusion, any trouble with finding words or speaking? Any numbness or tingling sensations? And any difficulty swallowing, difficulty catching your breath? I did ask that, yes, but we gotta go through the checklist here. Okay. Any difficulty with urination or changes in frequency? Any history of asthma? Diabetes? Previous heart disease? Okay, so due to the nature of your symptoms, I am going to need to run a couple of tests just to make sure that you are stable. Okay, so it's going to involve sticking a couple of things on you for a moment. Okay, so this one is just going to clip right onto your index finger, just like so. Let me make sure we got enough room here. So has your hand been shaking like that the whole time? Is it both hands? Can you hold them out like this for me? Okay, you can relax. Is that new? Okay, okay. Got it. Attention tremor, okay. I get that sometimes. One of the things that I discovered about myself in nursing school. Look at that, we have just enough left. Alright, so I'm going to connect you to our EKG, okay? It's not going to be a complete one, but I just need to get a reading of your current cardiac status. So, yeah, if you can, thank you. So this is going to go around the arm that does not have the pulse ox clip. for this to start up. Okay. So we can go ahead and disconnect you. So I'm gonna take blood pressure back. I'm gonna leave the stickers on you, but I'm gonna disconnect the wires. Oh, sticky back. Okay. Okay, well, your blood is nice and oxygenated. Your heart rate is a bit high, but your blood pressure is in normal range. So let's get you started with paperwork, because I will be having you brought back as soon as we have a bed open, okay? Which, hold on for just a moment. Hi, yes, this is Chelsea at the front desk. How soon are we looking to have a bed available? Okay. Okay, great. Yeah. I have a patient here who's having chest pain who... Yes. Okay, great. Thank you. Okay. So they're gonna have a room available for you in just a few minutes. They just need to clean it, okay? So in the meantime, I do have some paperwork for you, okay? So I'm going to circle the parts that we absolutely need filled out, and then the other bits we can get from you later. So here. So someone from our administration will be coming to collect your insurance cards and driver's license when you're in the exam room, okay? There are pens, right? Yep, you got it. So we just need to make sure that we have your name, obviously, address, phone number, date of birth, your emergency contact, and then we need you to sign for basically acknowledging that we reserve the right to charge a fee for any visits or anything not covered by insurance, your medications, any allergies to food, medication, or materials such as latex adhesives. On this page, previous surgeries, and then this page we'll need you to sign, basically stating that you will be providing all of your insurance information. If you don't have insurance, that you understand that you will be responsible for any charges. However, we do have payment plans and different programs for patients through the hospital. You just need to let the person who comes in to speak to you know that. And then this is our notice of privacy practices, stating in a nutshell that unless there is an emergency where it would cause harm to yourself or others, we will not disclose any of your medical information without your signed permission. Okay? Okay. So go ahead and take this. All right? And someone should be out to get you and take you back very soon, okay? Okay, good. Yeah, there is a little water fountain right back there behind the fish tank. Hi, yeah, this is Chelsea. I'm currently on the front desk at the emergency room, and I have a specimen I need picked up to be run stat for culture. Culture and viral testing, yeah. I know the culture can't be run stat, but the viral testing can, right? Okay, sorry, I misspoke. It is late, and I've been here for 10 hours already. Okay, it's ready at the front desk. Thanks. Hey. Yeah, it's right here. Thank you. Yes, it's definitely been a long day and a long night. Are you off soon? Yeah, I still have a couple more hours. I know. Okay, take care. Hi, my name is Chelsea. I am a nurse here, running the emergency room tonight. How can I help you? Okay. Can you give me your last name? Can you spell that? Okay. What's your first name? Have you been here before? Okay. Okay, I see. There's a typo. Okay. And can you verify for me your name and date of birth? And your home address, are you still on West 37th? Okay. And phone number ending in 5276? Great, okay. So what's going on? Okay, yeah, that is kind of gnarly. Alright. Let's take care of that. If this is not enough, guys, let me know and I can get you more, okay? Yeah, hold pressure on that. Good. And then let's take your temperature real quick. Okay, this just goes right under your tongue. Perfect. Okay. 98.3, normal range. Okay. Can I have you stare at me right here, right in between my eyebrows? Perfect. Good. Okay. Good. Okay. And now without moving your head, I'd like you to just follow the light, just using your eyes. Okay. Okay. So can you rate your current pain level for me on a scale of 1 to 10? 1 being like a paper cut maybe, 10 being excruciating, like you're gonna pass out? Okay. Have you seen anything other than blood coming out of that cut? Good, okay. And is it warm around the edges to touch? Okay. And I do see there is some red streaking going up the wrist there. Okay. Do you think you're going to be able to fill out paperwork? Okay. I'll have someone come out and help you with that then, okay? Just a moment. Hi, yes, this is Chelsea at the front desk in the emergency room. I have a patient here who's going to need some assistance with paperwork. Great, thank you. Okay, and then let me grab just a moment, okay? Need to take a swab of your nostrils. We are currently testing for a number of different viruses. So it's gonna tickle. It's just gonna go right around the inside. Good, okay. Okay. So go ahead and have a seat over there in the waiting room, okay? And someone's going to come out here and help you fill out some paperwork, all right? Okay, great. Hi, Chelsea again in the emergency room. I have another specimen for pickup. Great, thank you. Yeah, it's right here. Thank you.